Hello, you're watching sqadia.com and today our lecture topic is the spinal cord and we are on the first section of this lecture, that is the spinal cord anatomy. We will be going through the general considerations of how many vertebrae are there and what is their arrangement. Then we will be going through the anatomy of spinal vertebrae. How does a typical cervical, thoracic and lumbar vertebra look like? And what are the different parts of these vertebrae? What are laminae, what are pedicles, what are spinous processes? And in the last we'll be discussing briefly the anatomy of the spinal cord. So, what are the general considerations? The vertebral column is the central bony pillar of the body. It supports the skull, pectoral girdle, upper limbs, thoracic cage by way of a pelvic girdle, and transmits the body weight to the lower limbs. Within its cavity lies the spinal cord, the roots of the spinal nerves, and the covering of the meninges, to which the vertebral column gives great protection. The spinal cord and meninges are very fragile structures. They have to be encased in a bony column so that they can be protected. For example, our brain is also a fragile structure, but it is protected by a large skull, which is actually the bony part. Similarly, the spinal cord is actually protected by the vertebral columns. And then there are thoracic, then there are cervical, thoracic, lumbosacral, as well as coccygeal columns. Coming to the spinal vertebrae, the vertebrae column is composed of 33 vertebrae in all, but there are 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, which are fused to form a sacrum, a single bone it is, and 4 coccygeal, in which usually lower 3 are also fused. So basically, although there are 5, but the sacrum and coccygeal are sometimes also called as sacrococcygeal vertebrae because they are so much fused that they form one single sacrum bone, and then to them the attached is called a coccyx, which is actually the coccyx or the fusion of the coccygeal vertebrae. It is segmented and made up of vertebral joints and pads of the fibroplastic cartilage called the intervertebral discs. It is a flexible structure. The intervertebral discs form about 1/4 of the length of the column. On the right side, you can appreciate this is a typical vertebral column, it is called. If you see over here, it starts with the atlas. Atlas is the first cervical vertebra. Then the second cervical vertebra is the axis. Atlas, then it comes the axis. This is a large vertebra. It has a very large spinal processes. So when we are viewing an X-ray from the lateral angle, this is the vertebra which we need to identify. And then from there on we can identify different spinal lines, and then that actually helps to whether there is an injury to cervical vertebra or not, or whether there's any change in the symmetry of the spinal vertebra or not. As you can appreciate, then there are 7 cervical. Then after C7, the first thoracic vertebra comes in, and then from T1 to T12, this is a thoracic vertebra. Then from L1 to L5, you have lumbar vertebra, which are not fused as well, but the lower 5 sacral vertebrae actually fused to form a sacrum only. This is one bone. And then 4 of the coccyx also form coccygeal ligaments, actually vertebra fused to form a coccyx, which is a single bone as well. If you appreciate over here, if you see the cervical curve and lumbar curve is similar kyphotic curve, that is, it is actually concave from inside. But if you see the thoracic curve and sacral curve is a lordotic curve, that is, it is convex from inside. So if you are viewing it from this side, this cervical and lumbar curves appear concave, while thoracic and sacral curve appears convex. So sacral and thoracic nerves are lordotic, while cervical and lumbar curves are kyphotic. What is the structure of a vertebra? A typical vertebra consists of a rounded body anteriorly and a vertebral arch posteriorly. These enclose a space called a vertebral foramina through which run the spinal cord and its coverings. The vertebral arch consists of a pair of cylindrical pedicles which form the sides of the arch, and pair of the flattened laminae which complete the arch posteriorly. It has to be surrounded from all 4 sides. So anteriorly there is a body, on the side there are pedicle, posteriorly there are the laminae, and eventually culminating into a spinous process. The vertebral arch gives rise to 7 processes, 1 spinous, 2 transverse and 4 articular. The spinous processes or spine is directed posteriorly from the junction of the two lamina. The transverse processes are directed laterally at the junction of the lamella and the paticles. The articular processes are vertically arranged and consist of two superior and two inferior processes. And actually these two superior and two inferior means they actually form two joints. The two superior articular processes of one vertebral arch articulate with the two inferior articular processes of the arch above, forming a two synovial joints. So there is not actually one synovial joint between one vertebra above and below, rather there are two synovial joints. This is a diagram of a typical cervical vertebrae. On this view, superior view, you can see over here that this is anteriorly the body. As on the posterior lateral view, this is the body which appears as this. Anteriorly, this spinal cord is actually present over here, and anteriorly there is a body. Then on the lateral, there are actually the pedicles, as you can appreciate over here. And then this forms the laminae, which eventually culminate into posteriorly into a spinous processes, and then laterally give rise to transverse processes, which can be appreciated in this diagram. These are the facet joints, which actually are a form called the articular facets. There are two superior and two inferior articular facets forming two synovial joints between the adjacent vertebra. If you view the same vertebra from a posterior lateral angle, you can appreciate this is the spinal cord running through. Anteriorly, it is protected from the body of this vertebra. This is the spinal cord coming in, and there you can see the facet of the superior articular facets. There would be here, it would be inferior articular facets. This is all the transverse processes which are actually directed laterally from the lamina. Then the lamina terminate to form the spinous processes, and pedicles are actually on the lateral surface which connect the body with the lamina. And this is here actually the articular facet articulation actually occurs over these areas, over both two superior and two inferior articular facets. Coming to the pedicles, these are the notched on their upper and lower borders, forming a superior and inferior vertebral notches. On each side, the superior notch of one vertebra and the inferior notch of an adjacent vertebra together form an intervertebral foramen. The anterior and posterior nerve roots of the spinal nerve unite with these foramina with their coverings of the dura to form a segmental spinal nerve. Now remember, there were three layers of the meninges. That was the dura, arachnoid, and pia. Pia is actually adherent to the brain matter as well as to the surface of the spinal cord. Similarly, dura also runs along. When the nerve actually exits from the intervertebral foramina, the dura comes out along with the nerve. But once the anterior and posterior fusion of the nerve roots fuse to form a single nerve, at this point there's actually stoppage of the dura mater, and eventually the nerve axons of this actually come out of the spinal cord to form the peripheral nervous system. This is another diagram. Now you can appreciate over here is that if you see the cervical vertebra, they are more C-shaped and flattened, while thoracic vertebra, usually a typical T6 vertebra appears, their body appears to be heart-shaped and slightly. But if you see the L3 vertebra, a typical lumbar vertebra appears to be it's not actually heart-shaped, rather oval with a large body, with much more large spinous processes and overall a more bulky size, as it has to bear a lot of weight. They are present at the lumbar level. Similarly, if you appreciate over here, if you see that this is the intervertebral vertebral foramen through which the spinal cord has to pass. Although this is a big vertebra, but look at the vertebral canal space available over here. As compared to the cervical vertebra, it is a small vertebra. It's very thin out and flattened, but look at the space available for the spinal cord as compared to the lumbar. So in the upper cervical vertebra, although they are not strong from terms of bony point of view, but there is a lot of space available for the spinal cord. So the nerve injury, the transaction of spinal cord is highly rare, but if it does occur, it's highly lethal. It results in a quadriplegia. This is the diagram showing this is the spinous process. The typical C4 is a bifid spinous processes. It could be without this bifurcation as well. These are the lamina. On the lateral aspect, which is connecting the body with the lamina, is the pedicles, and then there's the transverse processes. Similarly, over here you have a pedicles. Over here, transverse processes are much larger because they have to get attached. The ribs actually are attached to the transverse process of the thoracic vertebra posteriorly as well as anteriorly, as you can appreciate over here. And in this lumbar vertebra as well, your long spinous processes, long transverse processes, large body and pedicles and articular facets, but very small space for the, or very small volume for the spinal cord itself. So in this, we have covered the general considerations of how many vertebrae are there, how many spinal cord, what is the spinal vertebra, what's the typical spinal vertebra is, what is the anatomy of spinal cord, and how actually there are kyphotic and lordotic curves present in the spinal cord, how many fused, how many not fused. All this have been covered in this section. Thank you very much. Keep watching sqadia.com.